So you just found out you're starting chemotherapy, and if you're feeling a mix of nerves, uncertainty, and 100 questions swirling in your head, you're not alone. The first day can feel intimidating, but knowing what to expect makes a huge difference. Here are 7 things to help you prepare for your first chemotherapy session. 1. Understand your treatment plan. Chemotherapy can be oral pills or intravenous infusions with treatment cycles scheduled every 2 or 3 weeks. Ask your doctor, how many cycles will I need? Will treatment stop after a set number of cycles, example 6 cycles, or will it continue based on response and side effects? What are the most common side effects I should watch for? What are the most serious complications, and when should I seek urgent care? 2. Prepare for IV access. We will check your veins to decide if chemotherapy can be given through a regular IV or if you need a Chemoport, a small device placed under the skin for easier long-term access. A Chemoport is often recommended for longer treatment durations like HER2-positive breast cancer requiring a year of therapy, drugs that can cause tissue damage if they leak outside the veins, Stage 4 cancers where multiple treatment cycles may be needed. 3. Plan your treatment location. Ask if your chemotherapy will be outpatient or daycare, a short hospital visit lasting a few hours, inpatient requiring an overnight hospital stay, home infusion where you take an infusion pump home and return later to have it removed. 4. Check costs and insurance coverage. Chemotherapy can be expensive, so get a cost estimate in advance. Contact your insurance provider or hospital help desk to check what's covered and what's out of pocket, if pre-approval is needed for certain drugs, whether a doctor's consultation is required before each session, if you can pre-book chemotherapy slots to reduce wait times. If cost is a concern, ask your doctor about generic versions. They often work just as well as brand name drugs. 5. Bring a support person. Most hospitals require you to have someone with you. Your companion can help with paperwork and errands, keep you company during the session, drive you home if you feel nauseous or tired after treatment. 6. Pack a chemotherapy bag. Bring things to stay comfortable and pass the time. A bottle of water, light snacks, a blanket or warm clothing, books, podcasts or music, a notebook or a phone app to track how you feel after each session. 7. Emotional preparation matters. Starting chemotherapy isn't just physically challenging, it's emotionally overwhelming too. Build a support system, family, friends, online communities. Find ways to reduce anxiety, meditation, breathing exercises, or journaling. Focus on what you can control, your mindset, nutrition, and self-care. Distract yourself during treatment. Engage in activities that help pass time. You are stronger than you think. Take it one step at a time. You've got this.